Hi, my name is Taiwei, and today I will be presenting on the system of healthcare worker well-being in Western North Carolina during the COVID-19 pandemic. First, note the distinctions between the following terminology that are specific to this presentation only: healthcare worker, provider, and personnel. In the first year of COVID, the U.S. lost 3,607 healthcare personnel to COVID. To put this number in perspective, we've lost 7,000 some American troops to the Afghan war from 9/11 to the end of 2019. That said, the main focus of this presentation will be on healthcare worker specifically, considering the significant disparities. Last May, The Lancet published a large nationwide survey on healthcare workers and found that support staff have higher stress scores compared to providers. National data from the first year of COVID also reports higher infection risk for support staff. Here is my rich picture to describe the system. I chose to narrow the system down to Western North Carolina because rural regions of North Carolina have great healthcare shortage problems. Regional clinics are not as concerned about improving the well-being of their existing workers thanks to the availabilities of healthcare workers that are leaving HCA and will gladly work anywhere but. In addition to the regional health system issues, with the onset of COVID, healthcare workers face other stressors and risks relating to COVID that are also outlined in the picture. Here is my stakeholder analysis. On the left are root definitions of the key stakeholders. The one common thing amongst the root definitions of these stakeholders is that they all believe the system should allow healthcare workers to provide quality care to patients. On the right is my catwalk analysis for two of the key stakeholders, healthcare workers and clinical leadership. To meet both their transformation needs, we have to ensure healthcare worker safety and provide adequate staffing to meet the healthcare demand of the pandemic. Here is a causal loop diagram of some of the key factors in the system. Note that the red circles have been identified as leverage points that we will discuss later. So some factors that directly affect healthcare worker well-being are things like COVID-19 infection rates, paid sick leave, hazard pay, PPE shortage, understaffing, overloading, and childcare availability. With schools closing and healthcare workers having to work in person, there may not be childcare options, and so by having the opportunity to work from home, that can alleviate the childcare availability issue. To address the issue of higher COVID infection risk, many healthcare organizations fell into the archetype of fixes that backfire. For instance, the mandatory daily attestations. Given that many healthcare workers do not have adequate pay or PTO benefits, many do not report symptoms or exposures with honesty. Thus, many healthcare workers became desensitized to the attestations and would ignore the protocols, resulting in workplace exposure to COVID-19 for both healthcare personnel and patients. From the causal loop diagram, I identified the following leverage points to use in the system transformation: opportunities to work from home, the reinforcing loops in staff retention and turnover, and overarching government level incentives. The design team will be utilizing user-centered approach and experience-based co-design process. Here, the healthcare worker will work collaboratively with the design team to translate their experiences and needs in the design process. My role in the process is to facilitate the process to provide a safe space for the design team given the unequal power dynamic. To do that, I will be focusing on three guiding principles for co-design team. 1, equalizing power relations to give voice to those who may traditionally have less agency in the organization's power structure. 2, supporting mutual learning to encourage cross-stakeholder interactions and considerations. And 3, foster genuine partnerships. So part of the co-design process is to empathize with our users, and here is persona A that was created from the empathy process. So persona A is a frontline healthcare worker. This is Janine. She's 25 years old from Burnsville, North Carolina, and has recently graduated to be a certified medical assistant. So she has 1 year of work experience under her belt. Her priority is health and safety. She is a single adult with no kids, earns the entry wage of $15.75 an hour, and she was reassigned to work in the clinic's understaffed COVID unit, working 50 to 60-hour weeks. She has fears of COVID exposure from the lack of PPE, and she worries about the long-term consequences if she should become infected with COVID. She's constantly stressed about being a COVID carrier and feels guilt whenever she runs essential errands. Because of this, she hasn't seen family or friends in 10 months. She experiences moral injury and trauma from caring for patients who are suffering from COVID. At this point, she has some regrets about her profession of choice and has thoughts of leaving the healthcare field. This is persona B, a non-frontline healthcare worker. This is Mary. She's 32 years old from Canton, North Carolina, with 5 years of work experience. Her priority is financial security. She is a single mother of a 6-year-old and makes $18 an hour. Due to her coworkers being reassigned to the COVID unit, she is now picking up the slack and working 50 to 60-hour weeks. She has no reliable childcare, with schools closing and daycare centers closing, and has to add an hour to her morning commute to work to bring her child to the nearest family member. This results in her being late to work more often, and she is worried that she might lose her job because of this. She also saw that some of her colleagues were transferred to work from home, and when she requested to do so, her request was denied. She is confused to why this is. She feels that there is unfair treatment. So to dig deeper into our single working mother, here is an empathy map. From this map, it's evident that Mary feels that she has little control to what happens to her. She's stressed from the demands of work and the risk factor from work, and there's an immense guilt. She is at risk of burnout and experiencing moral injury from her job. From the empathy process, we have identified these three main user needs to address. One immediate solution we can implement is an alternative work schedule to allow healthcare workers to rotate working from home by supporting telehealth appointments. Other long-term areas to address is organizational culture. Studies have shown that better work-life balance and better benefits and compensation are some of the most effective ways to address long-term worker retention. To implement the change, we can utilize scale PDSA cycling process. Before even launching the prototype alternative scheduling system, it's important to obtain baseline data using the measures listed here. Once that's been established, we will launch the new alternative schedule at one clinic. After a couple of weeks, we will obtain feedback from employees, then improve and repeat. Finally, we would obtain quarterly evaluations to compare with the baseline measures. After positive results from one clinic, we'll have the opportunity to scale it up to hospitals or larger organizational settings, and finally, norming it to greater Western North Carolina regional healthcare system. Lastly, I would like to end this presentation with one large, long-term solution in funding and policy change. In the first year of COVID, 3,607 healthcare personnel have died from COVID. Frontline healthcare workers are risking their lives and health, as well as their families, to serve the American people. And many were being thanked for their service with cards and lifesaver mitts. To thank those that risked their lives to serve the country on the war front, our government enacted the Servicemen Act to provide GI Bill and offered TRICARE coverage for our veterans. Similar structured federal benefits should be allocated for our healthcare heroes, especially those that have worked the front lines.